Hi, and welcome to the School Health Educators Podcast, where we discuss health education and how to best teach health ed in the K 12 setting. Hi, and welcome to the School Health Educators Podcast. I'm your host, Lori Reichel, the New York State health educator who believes in what we do. For today's episode, I invited some people to join me who I've met over the years on my professional path, so they can provide some words of advice, or if they don't mind me saying it, sage advice for those of us in the field. Basically, within this episode, each of these guests will answer three questions. One, what was your career, or what is still your career? Two, what were the best parts of being a health educator, including any best memories? And then three, what advice do you have for current and future health education teachers? So to introduce each guest, I'm going to let you know how I first met each person and then have them answer the first question about their careers. Now, warning, these folks know one another, so I don't know if they're going to be on their best behavior, yet it might be funner if they're not. So to start off is Dr. Gary English. And Dr. Gary English, it's so cool that I met him originally in New York. I'm originally from New York as a health education teacher. And I had the privilege of being in the first cohort of the New York State Healthy Leadership Institute. I was a health educator as well as a coordinator. And that's when I met you, Gary. So thank you so much for being here. And do you mind telling us a little bit about your career?
Sure. I guess I got to go back quite a few years, but Darrell can relate to this. I guess when I was in my undergraduate program, I really became more interested in health over the years. Having gone through the program as a health and physical education major, I was paired with Whitey Alpers in Hutchinson, Kansas, who was a very good physical educator. And then I did some health education under another gentleman. But Whitey's the one that really got me interested in attending the state conferences and beyond. And I think Darrell can attest to the fact that he was quite the character and really dedicated to the field, but got me rolling. So my first job was in Ripley, Oklahoma, and I taught K through 12 science, health education, physical education. I coached 5 sports, and I drove the bus at the end of the day, the activity bus.
Wow.
All for about $860 a month.
Wow.
So did that for a year. After that year, I took a year off and spent it in Vail, Colorado, working for Vail Associates, and that was kind of fun. During that time, I got connected with Darrell and headed off to Emporia State University, where he was my professor when I really kind of took a bigger interest in health education. So Darrell, again, was somebody who influenced me along the way and had me set up for a job there in Emporia. And I guess there was a bidding war at the time, but I ended up in Kansas City, Kansas, where I taught health and physical education for 5 years. Again, a connection through Darrell was with Dick Pappenfuss down in University of New Mexico. And I decided that, I'd like to do some work in higher education. So Darrell connected me with Dick, got a graduate assistantship, and ended up at the University of New Mexico for 3 years, where I got my doctoral degree. Upon graduation, I ended up back in New York, where I grew up at Ithaca College. And I was there for 13 years as a department head and teaching only health education. And that's when I really kind of took off with that. After that, I know. Lori, you're laughing, and it's like, wow, I didn't know all that. But after that, I took a job with New York State AFERD that was really part of the association with the CDC as school health coordinator for the state. And Did that for, I believe it was 3 years before taking on a similar job in Oregon, where I did that for another 3 years before returning back to higher education at Western Kentucky University, which is where I retired from until last week when I was asked to return for for the for the fall semester, but just teaching 1 or 2 courses. So
Okay.
that's where I'm headed. But in a nutshell, that's pretty much it.
Thank you, Gary. And if you're going to be teaching, we have to talk about whether or not we can connect some of our students together, because it might be that we can do some kind of collaboration work like you helped me last spring, in which I have to do a shout out. Gary helped me explain the whole school, whole community, whole child framework. He was actually the prosecutor for a fake court case, and the graduate students in the course loved it. It was the highlight of their semester, potentially the highlight in their whole program, because it was interactive. It kept their interest. So thank you so much for doing that and for introducing yourself.
Thank you.
Now, one of the people that Gary kept on referring to is Dr. Darrell Lang, who's also here. And what's interesting with Dr. Lang, I met him through Gary at an AFERD. Before it was SHAPE, it was called AFERD, but I know there are some names that were changed somehow in between. But I met you, Darrell, at an AFERD conference. I think it was in Salt Lake City. And I thought it was really interesting that once I received my doctorate, I ended up working at the University of La Crosse, in which you worked there at a certain point of your career.
Right, correct.
So thank you for being here. And do you mind telling us, Darrell, more of, or a little bit about your career path?
Sure. Yeah. Well, my career path is I'm originally from Iowa, and after I graduated, I was in the Marine Corps for a while, and I was discharged on Halloween. Could you imagine that? That's significant on Halloween.
Spooky.
Yeah, spooky is right. And then I took a job in upstate New York teaching high school health. I should have known, because the high school contacted me, and they're willing to pay for me to come from Iowa to interview for a high school teaching job. Now, that doesn't happen, but that should have told me that I should have known what the problem was, and it was an issue that we're not going to go into. But I took the position and was there for a period of time, and then my father-in-law passed away at a young age, and he was only 56, and my son was only about 1.5 years old, and so decided to go back to Iowa. And taught at a high school, in a small high school in Iowa, for a period of about 5 years. And then I taught at the University of Wisconsin La Crosse, and then from there I went to Emporia State, and that's where Gary came as a graduate assistant, and I was there for about 12 years, and then I left and went to the University of Wisconsin Oshkosh as a department chair, and I was there for about 4 years, and then I went back to Kansas and was worked for the Kansas Department of Education under a CDC grant, in charge of HIV/AIDS and human sexuality and health and phys ed. And I was there until I retired, and I've been retired now so 10 years. Yeah. So kind of retired. I still teach some online classes for different people. So that's kind of what I do. Yep.
Well, thank you so much for explaining that, Darrell. And can I ask, you remember where you taught in Iowa at the high school?
Yeah.
What town?
Small high school called Turkey Valley.
Turkey Valley.
In Jackson Junction, Iowa. Turkey Valley was 5 little towns that consolidated in 1960. They're all German, Czechoslovakian Catholic communities. I'm not of the Catholic faith, which was interesting, teaching human sexuality in the school like that. But it was about 30 miles from Decorah. So you have some idea where Decorah is. Yeah.
Excellent. Okay. Well, thank you again. And then last but not least is Dr. David Wiley, in which, David, you and I got connected when I started doing my doctoral work at Texas A&M. I remember you did a lot of work that some of the faculty was very involved in regarding pregnancy prevention. And then I think I got to know you even better when I actually participated in the International Conference on the Health Risks of Youth. And that conference it was a wonderful conference, wonderful networking, and the most beautiful location for a conference I think I've ever gone to, because we were in Los Cabos.
Yeah.
Do you mind giving some of your background?
Yeah. So briefly, my name is David Wiley. I'm a native Texan. Lived here my entire life, and I was a high school athletic trainer in my first life. And as a part of that, you had to have a teaching field, and I didn't really care much about teaching, but I wanted to get a job as an athletic trainer, and it ended up being that I got health and phys ed, and I taught biology my first year. And I ended up liking the teaching more than I did the athletic training. And so from there, I got really involved at the graduate level, a master's degree. And then I went to the University of Texas to get my doctoral degree. And then I stayed at Texas State University in San Marcos, Texas, which is just between Austin and San Antonio, for 30 years. I was going to stay 3, and 3 turned into 30. And as a part of that, I met a lot of really wonderful people in the field, including Darrell and Gary and a bunch of other folks that have really helped my career along. And somewhere in that mix, I got really interested in teen human sexuality, teen pregnancy prevention. And in 2008, I started the Texas campaign to prevent teen pregnancy. And one of the reasons I got really involved with this was in teen pregnancy prevention, actually in sexual health in a lot of cases. It's a predominantly female-dominated world, and men have not done a whole lot in terms of pregnancy prevention, education, et cetera. And so I really got this line of research. I was always interested in adolescent health, but really got interested in teen pregnancy prevention, sex ed, challenging the religious right, and how they were trying to censor health ed teachers and that kind of stuff. So I got really active in that stuff and brought along a bunch of my grad students as well. And again, some of them ended up at Texas A&M, some of them started at Texas A&M, but they were also interested in sexual health and teen pregnancy prevention. And so that's kind of what got me rolling. And I left Texas State in 2019, and I have already failed at retirement in that I've got a little part-time job now working for a nonprofit, and we're doing we have access to funds to do free mammograms for low-income women. So I'm their outreach coordinator to go talk to groups and get the information out there. So I'm actually continuing to help in the field, and actually probably helping directly more than I ever did in higher education, because we take these low-income women and we get them free mammograms and find them a medical home, and it's really rewarding stuff. So even though I left higher ed, I'm still trying to contribute. So that's kind of the short version.
Wonderful. Well, thank you. And thank you to all 3 of you for being here and for telling us more about your path of what you did in your career. And I have to do a little, a fun fact. I don't know if it's so fun, though, for people that aren't aware of how states look at sex ed. I did not know this until I was living in Texas, that not all states mandate medically correct information to be taught in the K through 12 setting as it pertains to certain health education topics. That's like a duh. You should be ethical and provide all the correct information.
Yeah. Lori, one thing I would maybe say to you is that I was on the board of directors of SECUS, and so Sex Information Education Council of the United States. So that's a resource for a lot of your possible students or individuals listening to the podcast. And they provide a plethora of materials that can help in looking at the various states and what they're doing as far as comprehensive human sexuality education, because those are changing. Each state is changing.
Yep. And I'll make sure that is definitely linked on the website for the podcast. Thank you for bringing up SECUS. Yep. Thank you. Okay, so going on to the second question that I have for you is, what were the best parts of being a health educator, or any best memories that you want to share with us?
Some of the best memories were meeting you and David and Gary. You know, it's the actually, if Don would have been here, the four amigos, we get together every year for a guys' weekend, some state or some city somewhere around the country, and that, you know, the police are warned before we get there. But one of the that's one of the things is the individuals you get to meet and share professionalisms with them. And then the other thing is that seeing the students who I had a student who I had in Turkey Valley in 1975 called me about 2 months ago, and she located me, and then she said, "I've been trying to find you." And she said, and as soon as you answer the phone, I recognize that voice.
Oh,
And I said, wow, you know, and she says, do you still have that mental health calendar that you used to put up every day in the office, in your room? And I had this old mental health calendar. There was one had for every month, and it had a different statement for every day. And she said, I still remember that and think
oh,
about that all the time. So that type of thing. And then the other thing is you know, students who then went on to graduate school, and like Gary and other people who have now become department chairs or deans, and just seeing that's going from that point on, you see that growth, and it's exciting to see that delivery.
wow. Thank you.
Well, and I will say that I concur with Darrell. I've made some lifelong friends. Had no idea that would happen. Also, I had lunch with a former graduate student. Actually, this past week was one of my best graduate students ever, and she is continuing to work in the field. And it's really nice to see you lay some, lay some seed out there and fertilize it, and watch these people grow up to do even better things than I did. One thing that I think was also the most telling was, and this is kind of a problem too, in Texas. It used to be health education was a required course. It is no longer. But what we would attract are basically people who were interested in being athletic coaches, and they weren't really interested in being teachers. And so what would happen, they would take a course like health education that you intentionally have to try to make it boring, and found a way to do it consistently. And so what I was really jazzed by was when some of these students got to college, they had never really had a good health education experience, and just watching their faces light up when you actually do professional things, skill-based training, talking about standards, tying things to student-based outcomes, and them actually getting it instead of, oh, gee, are we going to do the questions at the end of the chapter? And so that gave me a lot of hope. And not only that, but the fact that these people, then many of them would go into school health with a completely different attitude, because they were more likely to do what they had seen in the past, which was just do the bare minimum, get by, and take off on Friday for the pep rallies. Well, I actually show them how there's so many resources out there. It's so easy to do it the right way with the right amount of motivation, and that is carried on. That didn't reach everyone, but it represented a small percentage of people who actually are still in the field and doing good things.
Thank you. Thank you. And the both of you, I mean, referring to former students, I mean, they're wonderful. Our students are wonderful. Gary, how about you?
And I'll go ahead and build on that. In addition to it's a small universe of school health educators for sure. And I think that networking that we've done over the years, has paid great dividends, but I think it's also created a lot of relationships, personal relationships, opportunities to do things that maybe you wouldn't normally do. Maybe I have a little bit different take on this with students and stuff. In my last 13 years, I've been program head for the Department of Public Health, which is a little bit different than school health.
Right.
I'm still the school health educator at heart, but seeing how your perspective can change. We talk about sexuality education. We talk about all the things that we talked about in school health. but also getting students who are really into the public side of health and what they have done, some of the things that they have done, some of the places that they have gone to, and some of the places that some of the things that they've exposed me to. It's all a web. It's all a network of how do we make all this work? And I think school health education is one of those threads, if you will, that's part of the bigger schools. That's part of the biggest healthcare system. And that's been kind of exciting to experience over the years. I mean, even when we were working with the CDC and within the departments of education, there was always that little thread of public health that had an interest in what we were doing. And I think that our universe is much bigger than what we think of in terms of ourselves as health educators. And that was an exciting thing for me to experience over the years.
Can I ask this question? I know I didn't provide it for you before we met today, but what allowed all three of you, and then Dom, who wasn't available to be here today, what allowed all of you to stay connected? I mean, was it because of health education and just your belief in it? Because you all get along so well.
Well, I think that obviously we had a shared interest academically. We also did workshops together over the years, gone all over the country, in some cases all over the world, doing things together. And we're kind of somewhat in the same age group. Darrell is much older than the rest of us, but we're kind of in that all same age group. We think a lot alike politically, which is very important in health education. And it just kind of morphed over time. And it didn't start out like that, but it sure ended up that way.
Yeah.
Yeah, I am truly chronologically superior, but cognitive, but I'm also cognitively superior too. So.
Excellent.
But I think the other thing that we kind of experience over the years is that we're from different parts of the country and have different experiences as to what we can and can't do. And I think as challenges arise, we kind of bounce it off each other and try to figure out ways to get our message across without offending too many people. And, it seems to work pretty well, and we're not afraid to get out there and experiment with some things. And it's just been a good relationship all across the board.
Yeah. Because I think the networking, the reaching out, asking for help, that kind of stuff is so important that some people might overlook, like they think they have to do it all themselves. But like the three of you are fantastic resources to refer to. Fantastic.
Thank you.
Well, what advice do you have for current and future health education teachers? And anybody can start first.
Yeah, let me go ahead and take this because I've been thinking about this for a couple of days. Right now, there is a huge political movement in the U.S. to censor books, to control school board meetings, to censor teachers. Here in Texas, is the root of a lot of this stuff. I am very concerned. There's a big movement to, you have to remove all pornographic materials from Texas public schools, even though there's no definition for that term. And so what I'm worried about is that people are going to go overboard and remove anything dealing with sexual health, including basic biological. We can't talk to anybody about the menstrual cycle anymore because somebody might consider that pornographic. And so I guess I'm concerned about that, obviously, from a censorship standpoint as a civil libertarian. But I'm also worried. I saw this a lot in my dealing with student teachers through my university. A lot of teachers self-censor themselves. They're so afraid they might get in trouble. They don't talk about birth control. They don't talk about LGBTQ issues. When in reality, the number of teachers who have been fired over that is almost imperceptible. And I think that's part of the issue is that people are so worried about what might happen that they self-censor and they're limiting access to information that's crucial for young people, especially in today's world. When you look at when we all started teaching, there weren't any laptop computers necessarily. There certainly weren't any cell phones. And nowadays, every kid in school is carrying a computer with them in their pocket. Yeah. And all they've got to do is click on that mouse twice and they can have the most pornographic, explicit images they ever want to have. Yet somehow parents are concerned that a trained and well-trusted teacher is somehow going to offend somebody. I don't get that. And so I guess my word of advice, two things. One is that if you're going to go into health education, be aware of controversy, and it could be anything. School safety is controversial. Nutrition is controversial. Obviously, sexual health is, but don't use this as an excuse to censor yourself that, oh, you might get in trouble. Chances are no one's ever going to find out what you do once you close the door of your classroom anyway. And secondly, if you were by chance happen to get in trouble, you would be stunned at the number of people that would come out in your support.
Yeah.
I'd concur with David on that. Going back to where, Lori, when you asked me where I taught in Iowa, I told you it was 5 little towns that consolidated in like 1960, German, Czechoslovakian, Catholic, and I'm not of the Catholic faith. First thing I did is I went to the 5 priests, told them what I was going to teach in human sexuality, the pros and cons of every form of birth control, including the Billings method, which is taught in the Catholic Church. They said, fine, good. They just wanted to know that. And sometimes there were some parents that got a little upset, and I said, well, I'm going to use this priest is long gone, so I'll just say Father Moran said it was okay. She goes, oh, okay, that's fine, as long as I mentioned the priest's name. And I had students who had just said, we don't get this information. Nobody tells us this information. And whether it's in nutrition, in the Midwest, especially in Iowa, and I just shouldn't say it this way, but it's farm families. I didn't grow up on a farm, but my mother did, and it was like, eat your plate. Just think of all the kids starving in Armenia, and had no idea where Armenia was. But it was what is the nutrition that you have? What is what are the pros and cons to everything? And you can't run around scared. You just got to know your materials, and as David said, being open to people, and also you'll be surprised how many people will be supportive of you.
Gary, how about you?
I would say a couple of things in relation to the discussion that David and Darrell started. Let's not forget the concept of a school health council and getting people on board before you get your foot in the poop, so to say, and make sure that you have people that are going to back you up. I've seen situations where there have been questions raised, and if you've got a council that's supportive, you're pretty safe that way. But in a bigger context, what I'd say to incoming folks is, hey, don't be afraid to get out there. Don't limit yourself just to school health education. It's a big world. There's plenty of work for everybody. If you want to be a specialist in one area, go for it. If you want to expand your horizons, try something different. I kind of look at health as a ministry, if you will. If you're interested in it, there's a place for you. If you're a numbers person, there's epidemiology. If you're a social person, there's a place for you there. I mean, it's just a broad, wide open field that is small in terms of the people that you will encounter in terms of colleagues, but big in terms of the impact that you can have.
Absolutely. Thank you. Thank you.
One other thing I'd just like to say is that I think one of the things I've still continued to do is keep reading. I just finished a book. It's called Atomic Habits, which it's a great book. It's a great book, and it's kind of written almost like a PowerPoint. You could just create a PowerPoint off of it, but it's a very good book about developing habits and what are the triggers that go from various habits. So enough said, but keep reading.
I'm reading the same book. I'm just at the end of it. And I'm thinking, you know what? It's not just about making the goals. It's about those everyday things that you do in order to reach the goals. That's a great recommendation, that book.
Yeah. You never know where you might use that. You might, the various things that we talked about, the various cultures that you get to know, and I spent, when I retired, I went for 3 weeks down to Costa Rica and learned Spanish. And by the time I was done the 3 weeks, I could read, write, and speak Spanish.
Wow.
And, you go to cultures like David, and I took David with me to Guam, and he he became familiar with how to speak Guamese. And he became aware of the Chamorro culture, and it's a different culture, but it's important. Yeah. And he can attest that how many people were just so thirsty for information that they weren't getting. So
well, and that's the thing too. Now Darrell brought this up. Stuff that we consider to be pretty basic, like, oh well, this, and this. These people are writing down every word that we said, and it gave me a real reset that, wait a minute, a lot of these folks, these teachers, are either not trained in health education or it's been a number of years, because the stuff we were talking about was, I thought, relatively basic, and kind of found out not at all. So sometimes it involves reading your audience as well.
Right. Definitely.
And, that's kind of a topic for another day, but, oftentimes when we start discussions in class, we talk about the educational process and how you've got primarily elementary teachers that have no background at all in health, and we start hearing these horror stories of, teachers encouraging their kids to have sex or whatever. And it's like, I don't know what teachers they are. And they certainly weren't trained as health educators. And that sometimes carries up through high school.
Well, I thank you so much for being here, David, Darrell, Gary. It is a pleasure seeing you all, and I hope I get to see you in person again soon, perhaps at the International Conference on the Health Risks of Youth, or another conference. So I thank you so much for being here. Would you like to say goodbye to the listeners?
Thank you for the invitation, Lori.
You bet. Hasta la vista, baby.
You're all.
And to our audience, thank you so much for listening in. Please remember, number one, to follow this podcast on your favorite podcast platform. Two, to check out the schoolhealtheducators.com website. There's a whole bunch of resources noted on there, including some that were referred to today, if I can only say it. And number three, please remember that you make a difference. You matter. You matter to kids. You matter to your peers in the field. You matter for the future. So thank you so much again for listening in, and please stay well.